Welcome, everyone, to Vet NeuroJar, the podcast dedicated to exploring the intricate world of veterinary neurology. I'm your host, and today, we're diving into a fascinating case that pushes the boundaries of what's possible in treating a rare and aggressive form of cancer in dogs. We will be talking about primary intracranial histiocytic sarcoma, and we'll discuss a remarkable story of a Chihuahua who defied the odds. Histiocytic sarcoma, or HS, is a malignancy that often proves fatal in dogs. This cancer originates from interstitial dendritic cells and can manifest either in a localized form or spread throughout the body. While it commonly affects the subcutaneous tissues of the extremities, it can also target various organs, such as the lungs and spleen. Introducing the case. Our story begins with a 5-year-old spayed female Chihuahua, weighing just 3.4 kilograms. This little dog presented at a primary hospital with acute-onset hypoactivity and focal seizures. By the time she arrived at the hospital, the seizures had subsided. However, they recurred daily, prompting a referral to a specialized clinic for further investigation. Upon examination, the specialist noted a body temperature of 38.9 degrees Celsius, a pulse rate of 120 beats per minute, and panting. The owner reported that the seizures involved circling toward the right side, tremors, and forelimb elevation, symptoms indicative of a motor focal seizure. These signs pointed to a structural epilepsy caused by a forebrain lesion. Diagnostic journey. The diagnostic process was thorough and meticulous. Initial blood work and thoracic radiographs at the primary hospital revealed no significant abnormalities. However, neurological examinations at the specialized clinic uncovered circling toward the right side during gait, suggesting a lesion in the forebrain. The veterinary team considered several possibilities, including a brain tumor, meningoencephalitis, and caudal occipital malformation syndrome. To differentiate between these conditions, they recommended brain magnetic resonance imaging, or MRI, and cerebrospinal fluid analyses. The MRI, conducted under general anesthesia, revealed a solitary extra parenchymal occupying lesion in the right frontal lobe region. The mass displayed unique characteristics on the MRI scans: hypointensity and isointensity on T2 weighted images and fluid-attenuated inversion recovery, hypointensity on T1 weighted images, and heterogeneous enhancement effects on post-contrast T1 weighted images, accompanied by localized brain edema. Given the MRI findings, a computed tomography, or CT, scan was performed. The CT confirmed the presence of a mass with enhancement effects in the right frontal lobe region, but showed no other abnormalities in the rest of the body. Cerebrospinal fluid analyses revealed pleocytosis with mononuclear cell predominance and increased protein concentrations. Based on these comprehensive findings, the most likely diagnosis was a primary brain tumor, although Granulomatous meningoencephalomyelitis remained a consideration. The veterinary team suspected primary intracranial histiocytic sarcoma, PIHS. Can you tell us what the team did next?
Treatment strategy. With a diagnosis in mind, the veterinary team initiated treatment aimed at reducing cerebral pressure and controlling seizures. Single doses of mannitol and furosemide were administered intravenously. Prednisolone and zonisamide were started as symptomatic therapy to reduce brain edema and manage seizures. At the owner's request, surgical resection of the mass lesion via the transfrontal sinus approach was performed. Intraoperative gross findings revealed that the mass lesion was located outside the brain parenchyma and had a well-defined perimeter, making it possible to resect the grossly visible lesions. Post-operatively, the Chihuahua showed marked improvement, including increased activity, seizure suppression, and the disappearance of circling movements. To prevent post-operative recurrence and metastasis, the veterinary team started the patient on low-dose 1-2-chloroethyl-3-cyclohexyl 1-nitrosourea, or CCNU, at a dose of 45 milligrams per square meter every 4 to 5 weeks. Histopathology and confirmation. The surgically removed neoplastic lesions underwent histopathological examination. The examination revealed polygonal cells growing infiltratively in the meninges and brain parenchyma. These tumor cells varied in size, with eosinophilic cytoplasm and indistinct cell borders. The nuclei were round and irregularly sized, featuring one clear nucleolus. Mitotic figures were rare, and multinucleated giant cells were scattered throughout the tissue. Hemorrhage, necrosis, and the infiltration of lymphocytes and plasma cells were also observed, but there was no peravascular cuffing. These histopathological findings suggested histiocytic sarcoma, a suspicion that was confirmed by immunohistochemical staining. The tumor cells showed positive results for HLA-DR, IBA1 and CD204, and negative results for CD3 and CD20. These results led to a definitive diagnosis of primary intracranial histiocytic sarcoma. Primary intracranial histiocytic sarcoma is a rare and aggressive tumor, and at the time, there were no previous reports of it in Chihuahuas. Outcome and monitoring. Following the initiation of low-dose CCNU treatment, the veterinary team closely monitored the patient with periodic complete blood counts and blood biochemistry tests to detect any adverse effects. Grade 2 to 3 neutropenia, a decrease in neutrophils, was frequently observed in the complete blood counts but was reversible, asymptomatic, and did not necessitate medication reduction or discontinuation until day 278, the last day of CCNU treatment. Blood biochemistry tests performed on day 96 revealed elevated levels of alanine aminotransferase and aspartate aminotransferase. To address this, the patient was started on ursodeoxycholic acid, which successfully brought the liver enzyme levels back within normal limits. The patient remained in good condition with no apparent clinical manifestations, prompting another MRI scan on day 138 to evaluate for recurrence. The MRI revealed a small lesion with mild enhancement effects at the margins of the tumor resection site in the right frontal lobe, but no obvious mass formation was observed. This finding was interpreted as either recurrent tumor lesions or postoperative scar tissue. From day 180, given the stable patient condition and the absence of obvious mass formation on imaging, the interval of CCNU administration was changed to every 5 weeks at the owner's request. The patient's activity and appetite began to decline around day 285, leading to the discontinuation of CCNU administration due to persistent thrombocytopenia and further loss of appetite. Symptomatic treatment provided no apparent improvement, and a brain MRI performed on day 341 showed no signs suggestive of intracranial tumor recurrence. How did our case evolve from there?
Final days. Sadly, on day 359, the patient's condition rapidly deteriorated. Blood tests performed by the primary hospital revealed severe thrombocytopenia, anemia, jaundice, and renal failure. Despite inpatient treatment, the patient died on the same day. Unfortunately, a post-mortem examination was not performed, so the immediate final cause of death could not be determined. Discussion and significance. This case is remarkable because the Chihuahua achieved long-term survival after surgical resection and postoperative administration of low-dose CCNU. The median survival durations for histiocytic sarcoma in the central nervous system, including primary intracranial histiocytic sarcoma, have been reported as just 3 and 44 days. This Chihuahua survived for 359 days, which, to the best of our knowledge, is the longest surviving case reported. Several factors may have contributed to this extended survival. Previous studies have indicated that disseminated histiocytic sarcoma carries a poor prognosis. In this case, the tumor was localized, and aggressive local treatment may have played a crucial role in prolonging survival. Research has shown that surgical intervention can be beneficial in cases of resectable pulmonary histiocytic sarcoma without metastasis. The use of systemic chemotherapy, particularly CCNU, is also noteworthy. While there are no trials comparing surgery alone with combined chemotherapy for primary intracranial histiocytic sarcoma, the combination of aggressive local therapy and adjuvant systemic chemotherapy may be beneficial for localized central nervous system histiocytic sarcoma. The dose of CCNU used in this case, 45 mg per square meter every 4 to 5 weeks, was relatively low compared to the typical range of 60 to 90 mg per square meter. While the patient did experience grade 2 to 3 asymptomatic neutropenia and elevated liver enzyme levels, these issues were reversible, allowing for long-term treatment. This suggests that low-dose CCNU may enable prolonged administration with minimal adverse events, reducing tumor recurrence and extending survival. Final thoughts. In conclusion, this case demonstrates that solitary central nervous system histiocytic sarcoma without metastasis may benefit from aggressive local therapy, and adjuvant CCNU chemotherapy may further prolong survival. Even low-dose CCNU may suppress tumor recurrence. However, it is important to acknowledge that CCNU, even at low doses, can cause potentially fatal adverse events. Further studies with more central nervous system histiocytic sarcoma cases are needed to validate these findings and refine treatment protocols. Thank you for joining us on Vet NeuroJar. This case reminds us of the importance of vigilance, thorough diagnostics, and innovative treatment strategies in veterinary neurology. It also highlights the potential for long-term survival, even in the face of aggressive malignancies. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.